9 doctors later, she still didn't have a diagnosis. It wasn't until 10 months later that she was finally diagnosed with Lyme disease, which comes from getting bitten by an infected tick. But the damage of not getting treatment for those initial 10 months remains.
It's heartbreaking to me that our physicians in this area aren't more aware and literate about Lyme and tick-borne disease.
That is something Dr. Kerry Clark at the University of North Florida is working to change. He says it is much more common in Florida than most would believe.
My research has identified hundreds of cases all across the southern United States, many of them in Florida. And this is just one of the many myths about Lyme disease that we're trying to dispel.
Because Lyme is typically considered a problem in the Northeast, it is often not tested for in patients in the South. Not getting treated with antibiotics immediately means the disease will continue to spread throughout the body, making it harder to fight. From 2000 to 2012, there have been 913 reported cases of Lyme disease in Florida. But even for those who do test positive for Lyme, getting treatment can be a serious challenge.
But this disease, in every step of the way, it was like entering the twilight zone.
When Dane Boggs became very sick after what he thought was a spider bite, he waited 2 painful years before he was finally diagnosed with Lyme. Even then, Dane had to travel all the way to South Florida to see a doctor that would treat him.
His condition was such that they recommended an IV antibiotic. After 2 months, my insurer declined continued payment of those drugs, which cost in the realm of between $5,000 and $7,000 a month.
For Lyme patients like Dane Boggs, it isn't uncommon for their insurance companies to deny coverage. That's because the CDC does not recognize Lyme as a chronic or lifelong disease. The CDC argues that the symptoms after treatment may go away with time. Dane and his wife disagree and have spent around $100,000 out of their own pocket seeking treatment for his Lyme disease. Another challenge Lyme patients face is just finding a doctor. In North Florida, Dr. Shirley Hartman is one of the only doctors that treats Lyme disease patients. She understands what her patients have been through. For years, her own daughter was thought to have fibromyalgia and chronic fatigue syndrome, only to then test positive for Lyme.
They're patronized and told that they're not really sick and that, they just need to buck up and live with it.
Doctors themselves are not immune to the anti-Lyme bias.
It has happened that insurance companies have complained about physicians that prescribe expensive long-term courses of IV antibiotics that the insurance companies have to pay for. And then these physicians are investigated by medical societies and boards. And some of them have lost their licenses or had to move to other states.
It just seems so deceptive, actually, in terms of absolutely dismissing the existence of the disease.
In Jacksonville, Katie Jeffries, First Coast News, NBC 12, ABC 25.
According to the Northeast Florida Lyme Association, awareness is key here. A couple of things. Symptoms, for one, includes circular rash right around the tick bite, severe fatigue, as you heard there, joint and muscle pain, fever, and more advanced cases of nerve problems, maybe problems thinking, not having a clear head. Also, not all blood tests check for Lyme. So if you suspect that you may have Lyme, ask for something called a Western blot test. Now, May is Lyme Disease Awareness Month. We are attaching it to that. And to learn more about the disease, more about this month, more about resources available, go to this story on firstcoastnews.com.
Good information to know. Well, we are following